This podcast is produced by the Center for Deployment Psychology at the Uniformed Services University of the Health Sciences. The views expressed are those of the speakers and do not necessarily reflect the opinions of the Uniformed Services University, the Department of Defense, or the U.S. government. In addition, references to any specific companies, products, processes, or services does not necessarily constitute or imply endorsement by the Uniformed Services University, the Department of Defense, or the U.S. government. Welcome to CDP's podcast, Practical for Your Practice,
where we give you actionable intel to support what you do, one colleague to another.
Hello and welcome, or hopefully welcome back to Practical for Your Practice. I am Jenna Ermold, and today I am joined by co-host Awesomeness, Kevin Holloway.
I need you to introduce me every day. That made me feel good.
I know. Well, I was going to say fabulous, but I think I literally just said fabulous with Corinne, so I needed to pick a new word. And awesomeness isn't actually grammatically correct, but we just went with it. So
I will take it.
Yeah. So Kevin and I always feel lucky to be on the podcast, but we feel especially lucky today because it's really fun when we get to have our colleagues that we love to hang out with come on the podcast, and not just come on the podcast, Kevin, but come back to the podcast. Because this friend, colleague, maybe we should call that a frolic, has been with us before. The lovely Dr. Robin Brody. Welcome back, Robin.
Hey, welcome.
Thank you. I'm so happy to be back. And so soon.
Right.
Yes, Robin was in season 6, but we often have really interesting conversations with Robin in consultation or outside of consultation. And so it's her fault for being interesting because it just makes us want to have her back. Interesting and wicked smart. So what the conversation we were having, I'm going to have you reintroduce yourself in a second, but the conversation we were having was about narcissism and narcissistic abuse. And we realized we had never really talked about that on the podcast. So we're excited to bring Robin back to talk about that. But before we go on, just in case anybody missed your episode last season, which was, Kevin, what was it again?
It was episode 6 in season 6. So that should be easy to remember.
Yeah, episode 6, season 6. Can you just give our listeners a brief bio, who you are and what you do?
Absolutely. Yeah. Dr. Robin Brody, I'm a clinical psychologist currently in private practice. I am also on voluntary faculty at Weill Cornell. I spent my career up until leaving for private practice, was in the VA system, was in academic medicine, doing primarily PTSD work, mostly with veterans, with occupational stress and trauma, moral injury, traumatic invalidation. That kind of led me into being interested in the topic of narcissism in the first place. And I'm sure there's much more I could say, but won't.
That's a good recap. Yes, and we are lucky enough to have Robin come to our prolonged exposure, continue learning and consultation periodically, and she always brings really interesting. The work she's doing is always really interesting and good perspective. So, anyway,
welcome back.
Welcome back. Now, I'm going to start out by saying narcissism and narcissist is a phrase and a term that gets thrown around quite a lot. Obviously, I like my teens throw it around, and gaslighting, it's like a thing now, right? So I do think, there are a lot of folks out there that really have, I would say, gaps in their training regarding what is narcissism, what is narcissistic abuse. So I do think it'd be great to start today by defining those terms. And we'll start with maybe like, what are the key features of narcissism? How does that tend to show up clinically, as you would describe it?
Yeah, I think you're making a really interesting point, which is, and I agree, it was not a big part of my training at all. I have a distinct memory of the psychopathology class where we talked about personality disorders, and it was like, here are the criteria for NPD, and next slide. And that was about it.
Yeah.
And I think that's an experience that many people share. And I think thankfully the conversation has shifted and like many I think topics in the field and in the zeitgeist, we have kind of swung in perhaps the opposite direction, maybe too far, maybe not too far. But yes, the term is being used with great frequency, and I actually do think it is something that is very common and of course exists on a spectrum.
Sure.
Mhm.
So yes, we have NPD kind of at one end of it. But when we think about narcissism, kind of the core stuff of it is a sense of entitlement. And this really kind of is the factor that bridges between various types of narcissism. So I'll talk a little bit about those types traditionally. And NPD, or narcissistic personality disorder, really has a focus on grandiosity and grandiose narcissism. And historically, that has really left out of the conversation vulnerable narcissism or malignant narcissism. Like that's not been something we've talked about.
Yeah.
Yeah.
So I will speak to that in a second, but when we kind of think about what bridges across all of these subtypes, it's this entitlement, this I deserve special treatment. And that's really consistently correlated with measures of narcissism. Other core pieces of it is selfishness, grandiosity, low empathy, kind of this like shallowness or like performative empathy or kind of cognitive empathy. And this can be kind of confusing to people because it's this sense of like, well, like they seem like they are empathetic. They're kind of saying the things and doing the things, but like it's not totally there.
Performative is a great word, right? Like they're acting like they've got it. They know the right things to say,
Uh-huh.
but maybe it's not actually the experience underneath.
Yes, exactly. And what we see is that those who kind of trend towards more narcissistic traits, they do perform empathy when it serves their
Mm,
needs.
mm,
There's also kind of across narcissistic types, there is validation seeking
Mhm.
and this superficiality or kind of this sense of like, I've known this person for years, but I don't really know them. Or I've been working with this patient for years and I actually have no sense of like what this person's life is. Like it really stays on the surface. So that kind of cuts across all of the types of narcissism. Vulnerable narcissism is going to be, I think, if you see someone with narcissism in your practice, most of the time it's going to be someone with vulnerable narcissism. And the reason for this is that vulnerable narcissism maps more closely on with some of the other types of psychopathology you see. There is much more negative affect.
Mm.
They're oftentimes kind of called the like disagreeable introvert.
mm,
So if grandiose narcissism is kind of the like, I am king of the world, vulnerable narcissism is like, why doesn't anyone see that I am king of the
hmm
world?
Mhm.
It is, no one sees like everything that I'm doing. This, like, I have been slighted. A lot of negative mood states. Kevin, it looks like you want to say something, so please interrupt me.
I'm not narcissistic enough to interrupt, but no,
Please,
well, I was
please.
just gonna say it sounds like these are not mutually exclusive either, right? You can have the grandiosity and that disagreeable introvert thing going on at the same time. In fact, it sounds like you need to have both. You need to have that entitlement, but then also that extra wound that nobody even sees this, right? And I
Mhm.
wonder if that's related. Like I sometimes hear about kind of narcissistic fragility, this idea that kind of I have all this entitlement and nobody's noticing, and it really wounds me when, somebody isn't seeing how awesome I am.
Yes. So, with kind of the underbelly of across types of narcissism, really the underbelly of it is an immense shame
Mm,
and low sense of self. So, one of and I'm jumping around a lot here, but I think kind of one of the tools that can be really helpful in thinking about narcissism and is the alternate model of personality disorders in the DSM-5, which was not something I was really encouraged to use in my training.
Mm.
But it is very helpful, as it turns out. And for those who are not as familiar with it, it kind of breaks functioning down into self-functioning and interpersonal functioning, and then further breaks it down into kind of self-functioning into identity and self-direction. And so it describes narcissism as excessive reference to others for self-esteem and regulation, self-appraisal and self-aggrandizing, kind of this like inflated sense of self, and then looking to others for self-esteem, right? And that like needing that recognition to regulate one's sense of self and one's kind of emotional states. And that when that is not received, or like when there isn't that reflection of you're so great, like you're the king of the world, right? Like, and that shame is activated, that's when we will see like the flying off into the rage piece of things.
Well, okay, so and this is fascinating that, in my head, and like you were just saying, like Jenna was saying, I didn't get a lot of training about narcissism and its variations, really. In my head, it was kind of this one thing, right? And so have had this bias, and maybe you can correct me on this bias that narcissists don't show up clinically. Like they're not coming into the office saying, I love myself too much, or, hey, this pattern that I've noticed is getting in the way of what I need to accomplish or my relationships. Like, how does this show up clinically? Like, where do we notice that in the clinical office? If that's, and you can correct me too, if that's not true, but if they're not coming in saying, hey, this is my presenting concern is narcissism, how does that show up?
Yeah. So the grandiosity, the grandiose narcissism is not likely to present.
Right.
Same
But
with
vulnerable.
the malignant narcissist, also not likely to present outside of a forensic setting. Get yourself in a prison, you're gonna see it. I think like sometimes looking back, like I think there certainly have been in some of these settings, kind of like VA inpatient, some other like they will present in some places, and that bears out in the data. But your typical outpatient community setting, probably not going to see this. You are absolutely going to see vulnerable narcissism, and you see it comes in, sometimes it looks like kind of these failure to launch cases, right? There's this tendency in vulnerable narcissism for there's arrogance, entitlement, kind of this victimization, sullenness, a lot of abandonment fears.
Yeah, that's what I was going to say. I could see that showing up clinically quite frequently. And I mean, not that every client you're going to see has that, but that if that's the presentation that to me makes a lot more sense, that they would say, look, the world is just not recognizing, and sort of that victimization piece.
And I think that the like kind of when I started to learn more about narcissism and like reflect back on some of my cases, I was like, there were many where I was like, oh shoot, that's where I missed it. And some of those places where I kind of came to see that I missed it was like places where there was maybe I saw PTSD, I saw social anxiety disorder, and they weren't necessarily responding as well to our EDPs as I might have expected. And the things that kind of stood out with hindsight were there was a sense of kind of like hostile attribution bias that maybe went above and beyond what we would typically see with social anxiety or PTSD, and a like lack of responsiveness to feedback. There's also this sense of like those in relationship with these individuals, there is a sense of pity often, and a sense of like you can't possibly understand how uniquely broken I am and how I require special treatment because of it.
And I also wonder if that presentation, sometimes you end up being pulled into how others are pulled into relationships with those who are narcissistic. And so, at first you might be doing things to balance thoughts around that and validate things, and that's, kind of actually getting in the way of ultimately some goals that you might have.
Mhm.
I'm a little torn right now because I know the other piece we really want to talk about is being on the flip side of that, and how, important it is to also, in case conceptualization, be thinking about those who are sort of victims of narcissistic abuse, the people who are in relationships with or um, contending with this. What does that look like? The flip side, how might that show up clinically? So like we've got to have our spidey senses up for narcissistic personality disorders, and I'm really glad that you went over the different types. But how else do we need to be aware of the impact of narcissism clinically?
Yeah, absolutely. And I think to fully appreciate that, I want to say one more thing about malignant narcissism.
Mm.
Because I think unfortunately to fully appreciate that, we do have to kind of appreciate how narcissism functions, right? So again, kind of appreciating that this exists on a spectrum, and kind of thinking about this as like, yes, a Venn diagram where malignant narcissism starts to kind of like bleed into some like ASPD or antisocial personality disorder,
Hmm.
right? With malignant narcissism, we see a lot more of the manipulativeness, exploitativeness, like menace, cruelty, control, deceitfulness,
Yeah.
need for power, profit, pleasure above the dignity and rights and needs of others, right? So
Hmm.
when that is how someone is oriented, right? And we think about what that would look like for the children, partners, parents, employees, coworkers, bosses, right? Whomever in that person's life, we start to have an appreciation for what this is going to start to look like. Unfortunately, and what part of what this looks like is when you have a malignant narcissist who puts their need for power control over the needs of others, they tend to become very successful in their fields. And a kind of hallmark of narcissism is this kind of sense of, or what's called like masking.
Mm.
This really common experience for those in these relationships of to the outside, and in particular with kind of the grandiose narcissism or malignant narcissism, where on the outside, like when we're in public, this person is charismatic and charming and the life of the party. And the second we get in the car, all hell breaks loose,
Mm.
right? Which can become a really confusing and isolating experience for the people in the narcissist's life, right?
I was gonna say, I imagine that in some ways too, the narcissist sees these as benefits, right? Like this is working for them. This is helping them, function in life. It's helping them to achieve things that not the everyday person is achieving. And so I can certainly understand how in some ways they don't see this as a problem, right? Like I'm remembering an article I read several years ago. I don't have the reference. I'll look it up before we get it into the show notes. But I think it was entitled "Snakes in Suits." The idea that some narcissistic traits are in some ways rewarded by society.
Mm,
It's absolutely rewarded in society, and the data backs this up. There's data to support that those with higher traits of narcissism are paid more, are more
Hmm.
likely to have higher positions. Like our society selects for this.
Right.
They aren't, right, and this is to your earlier point, Kevin, like they aren't going to show up in our offices, right?
Yeah.
It works for them.
Right.
It absolutely does. And like I truly fundamentally believe like this is a public health issue.
hmm,
And yes, we as psychologists, yeah, we need to be doing our part, but like we aren't going to be the ones to address this. They're not showing up in our offices,
Hmm.
right.
right? And it's really, really hard for us to be doing research on treating narcissism, right? It's hard to capture it in our assessments. And it's really hard to do a randomized control trial on narcissism.
Right.
Right.
They don't
Right.
come to research studies. So we
And why
have to
would
have a
they?
public health approach.
Yeah, that's so tricky. Is it okay if we kind of now go back to Because I want
Absolutely.
to empower providers to do something. Since we can't get them in clinical trials, how do we maybe approach it on the flip side, which is, this idea of narcissistic abuse and how that might show up for us clinically, and where we really do have tools in that arena to support clients that we're working with to make changes in those relationships and in their lives that are going to be more functional.
Yeah. I think like to even take a step back here, I think the most impactful thing has been to educate myself on it.
Hmm.
Like this is a gap in our training. I think in general, my experience talking to colleagues who are psychologists, I think actually more so than some of our other colleagues, social workers, et cetera, by and large, we are not trained in domestic violence.
Right.
And like, I don't know why this is, but I think we as psychologists have some catching up to do when it comes to antagonism in relationships. So I think the biggest thing we can do to help our clients is to educate ourselves a bit more,
Right.
frankly. And I can happily share some resources for that and link those in the show notes, because then you can be like, that can help you kind of be on the lookout for it and start to hear these
Yeah.
things. So first and foremost, like having some of the information that we've already talked about, like I start to pick up on things as people talk about the people in their lives. I am very careful to not label people in my patient's life as narcissists. It doesn't work very well.
Imagine that.
We'll tend to have some feelings about
Well,
that.
but also one of the things you mentioned earlier, right? That this is really a spectrum. We're not talking about it's present or it's not. We're not talking about, that they are a malignant narcissist or they're unaffected by this. That they can have traits, they
Mhm.
can have features, that there's this spectrum. And so if we're kind of defaulting to labeling people, that's kind of that on and off, present, not present kind of approach. So we can recognize those features without going all the way and saying, well, they've got NPD.
Yes, right. So, like speaking to a pattern of behavior that has been
Yes.
persistent over time and the impact that that
Hmm.
has, right? Like that is something I can comment on. And have you noticed that? So, kind of what does this look like? I think understanding some of the dynamics of this relationships. I think one of the other words that we love to throw around in this space, Jenna, you mentioned gaslighting.
Mm.
I think similarly, I try to not use that term in my practice. It's just very emotionally
Yeah.
charged. I use denial of reality. I think it just is more descriptive, and that is a common feature in these relationships. Using confusion and confusing reality and kind of the sense of like getting put in a blender and like spinning around is a tactic that is used consistently in these
Mm.
relationships. Trauma bonding is another really misunderstood and overused
Term, yeah.
term,
Yeah,
but
yeah.
really what that tactic looks like in these types of narcissistic abusive relationships is a formation of emotional attachments under conditions of intermittent reinforcement. So right there is kind of like we learned in intro psych, there are moments where it is like amazing and this incredible relationship. And then there is really intense negative emotional experiences and very confusing. And then it's really good again. And then it's absolutely
Mhm.
terrible. Right. And it's the person is kind of always left on their toes of like, when is it going to be good again?
Mm.
And maybe that really good moment is just around the corner.
Mm.
Right. And that is what keeps this person in this relationship is like, yeah, but maybe I'll get everything just right, that I'll get that really good piece of this person that I know is possible
Right.
again at some point soon. So that is a tactic that is used to keep people in the relationship. I think another kind of helpful piece to understand is, similar to other forms of domestic violence, is to understand the kind of the cycle of abuse in a narcissistic
Mm.
relationship. What we see with like truly, it never ceases to amaze me how kind of consistent this cycle is, this pattern where initially there is a pattern of kind of idealization where things are fantastic, right? This is probably not when you're going to see this patient
Right.
unless you already are working with the person. But this is not when a person comes in and says, everything is terrible. I need to start therapy and talking about my relationship, right?
Mhm.
Things are good. And then after some time, things start to shift, right? Whether this is a parent, boss, romantic relationship, whatever it is, things start to shift. I'm going to interrupt myself here. I think it's also important to note that like two narcissists can also be in a relationship with one another. And that can also complicate the
I hadn't
dynamic.
thought about
But
that.
it is not, yeah, it is not just a one-to-one here. So I will just note that it complicates all of this, of course, but I think it is important to also note. So idealization, it is very seductive, things are great. It moves to a place of devaluing, right? This is where we see kind of the fall from grace a bit, if you will. Then is kind of like a discard. I don't need you, useless. Some sort, this is maybe where we see some infidelity. And then ultimately kind of what we call like hoovering or some sort of attempt to bring the person back in after they have been discarded. And so having this cycle in mind, right, we will often see the people in this relationship kind of like in those after the initial idealization piece of things, but to kind of have a sense of where is this person and where are things going as well, to have some sense of like how to help this person, if they are wanting to leave in the kind of discard phase, like how do we anticipate that right around the corner is the narcissist going to be like, they are going to be trying everything in their playbook to get the person back, and how to help this person stay gone, basically, is going to be maybe some of the tools you'll need.
Again, it's like, how would you, but we're recognizing a pattern, we're seeing the cycle. Are there treatment approaches to approaching this when you
Yeah.
see it?
So, to my knowledge, we have not done any, there is no gold standard treatment approach specifically for narcissistic abuse. I think those living with the effects of narcissistic abuse are going to come in with diagnoses across the spectrum. And I think we need to continue to use our evidence-based treatments for those things, but it is essential to understand what is happening within the context of narcissistic abuse, because our best treatments for, say, social anxiety or whatever it is, like we can't just have this person going out and doing exposures without understanding the context that they are in, right? I can't go send someone home and have them go practice like their interpersonal effectiveness, dear man,
Right.
boundary, like setting skills, because it is not going to work and it is going to fail at best. And at worst, they are going to like end up being re-traumatized or in a very dangerous situation and because of it. So it is about having a understanding of the context that this person is living in addition to using our evidence-based.
And advocating for a change in the context, or
Not necessarily, right? So I think it's about also understanding the amount of kind of structural power and privilege that the individual holds, right? Because it might be that culturally, this person, like they cannot leave this relationship, right? Financially, they cannot leave this relationship. I think the other thing is like those high in narcissism, especially malignant narcissism, are very litigious.
Yeah.
So when it comes to issues around custody, our court system is not set up to protect those who have suffered at the hands of narcissistic abuse. It is not. It goes very, very poorly for survivors. And we need to have a realistic expectation of that going forward. I've worked with people who certainly have left these relationships and gone on to live like rich, fulfilling lives. Sometimes it is about learning how to carve out a tiny micro space within the hell that they're living in where they can exist freely as possible
Yeah.
and as safely as possible within that. And a lot of psychoeducation goes a very far
Yeah.
way about what is happening. Because the experience of this type of a relationship is so crazy making.
Yeah.
Um,
As I say, I imagine
that
that
just
that's a big part of it, right? Is helping that person kind of see the pattern,
yes,
reassuring them that they're not crazy, right?
yes.
That this isn't their fault, really, and helping them to, whatever context they're in and whatever constraints on that context there are, how can you exist in that space in a way that works for you,
Mhm.
and that it's not, maybe even not accepting the pattern as it is, right? And blaming
Mhm.
themselves.
Mhm. And I think like one of the things that I often work with the folks that I'm working with on is like, right, like there can be this way that those around a narcissist will kind of like tiptoe to try to avoid setting off the landmines, so to
Hmm.
speak, right? That there is this way that everyone kind of tries to make things perfect as to not set off the narcissist, right? And if I just get it right, then things will be okay. Right. And that is a fallacy, right? It is always heads I win, tails you
Yeah.
lose.
Yes.
Yeah.
Right.
Right.
And so a conversation that I have with folks often is like, well, it's not going to matter either which way, right? Because it is heads I win, tails you lose. So you might as well do the thing that you want to do anyways.
Right.
And so oftentimes it is around like accepting that reality and choosing the thing that's best for you and coping ahead with the fallout because the fallout's going to come.
Right.
Yeah.
Right.
Well, I'm really trying to wrap my head around this. I wonder if it would help. Like, do you have a case, a story, of course, protecting confidentiality, to illustrate what you're talking about, like something to help us understand this process?
What this might look like in kind of a typical situation is kind of an example that I recently was working with is an individual who is, high up in her field who comes from a family where her father was a pretty successful in his line of business. Mom stayed at home. Sounds like from what she has shared that there was a high degree of narcissism in dad. Her husband is very demanding. He earns a significant amount more than she does, despite the fact that she is, as I said, very successful in her own right and really, really loves her career. Um, as she has as his career has continued to kind of take off and he is doing more and more, he has like the demands that he has placed on her have just continued to increase and has less and less empathy for her stress. Like there is no room for her to be stressed. It has zero patience for the house not being in order
Mm-hmm.
at the end of the day and why haven't you gone to the grocery store? And like zero ability to hold space for the fact that she might be having her own experience with this. His mom also lives nearby and very much so kind of colludes in this dynamic. My patient writes this whole dynamic with his mom off as like it's cultural and all of that. And yes, I should be doing it. It's, kind of like this wifely duty, even though this is entirely inconsistent with her values. And we've talked about that a lot. Right. But that is part like, and I think it kind of highlights the way that the systems around the narcissistic individual like will enable this behavior.
Yeah.
They are considering having a child together. I feel concerned about that for
Right.
many reasons, in part that like it's not something she wants. But it is very much so something that is like the duty that she feels that she must give him and that right like again she's expected to of course give up her career because of all of the things even though it's not what she wants to do and there's no capacity for him to perspective take
Mm.
on this and this is a kind of another dynamic that is often seen like the more commitment that ratchets up, right? So when they moved in together, kind of the dynamics worsened. When they got married, things ratcheted up again. When they have a child, I imagine things will also worsen as the levels of commitment increase.
Wait, having a baby doesn't solve everything?
It not only doesn't solve everything, it tends to make things
Yeah.
worse.
It pulls attention, right?
Ooh,
Exactly.
yeah.
There is more control. There is less of a capacity to get out. And it increases that sense of stuckness.
Yeah.
We go kind of round and round these, this cycle of things are terrible. She starts to see it, and then there's a good day. And there's like, or a good date where she's reminded of like why they fell in love in the first place. And there's like, or not even like a date, there will be like a look where she like has that feeling again of like, oh, right, this is why. And then it doesn't matter that that is like so fleeting compared to the,
Right.
months and months and months in between. Right. And so that's kind of that like intermittent reinforcement that like is so, so treacherous to break out of.
It sounds really frustrating as a therapist working with that too.
It can be. It absolutely can be. It is, what I can say is like, as someone who comes from a world of like, we're doing CPT in 12 weeks, let's go.
Right.
Like, you gotta throw it out the
Right.
window. It's not
Yeah.
happening. Like, get rid of it. Like we might be able to do CPT in 12 weeks, but we're not going to treat the like effects of narcissism in 12 weeks
Right.
with an EBP.
Well, I was going to say, Robin, too, well, Kevin said that's frustrating. I think it's frustrating if you don't put it in the context of narcissistic abuse, right?
Right. Right.
So when you're like,
Yes.
what? I don't understand this. Why are you doing, why are you, like, it's very clear these things are happening. So I think in some ways, being able to pull that into your case conceptualization allows you as the provider to be more patient and have more empathy,
Yeah.
because you're really understanding all the things that are working to keep it in place, keep these behaviors in place.
Yeah. The other, and I want to hold the other side of that is like, sometimes it is really slow going and it is frustrating. And like, I want to just kind of like shake things loose. And
Stop that.
on the other side, like sometimes like things just click and it like all unravels at once. And
Mm.
it is so freaking amazing. And like people do leave or they don't, but they get it and
Yeah.
they make changes and they like go on and stay in their relationship, but just live differently. And it is really, really amazing, rewarding work to do.
Yeah.
Well, and especially just the validation around that, right? So even if somebody can't leave, or even if they can't make the changes that would ultimately be more fulfilling and lead them to a better life, being able to
Mhm.
understand with somebody else walking beside them, what this actually is can also be, I think, kind of freeing and validating and just putting words to it. Given time, I'm aware of the time. I do want to shift us to, as our listeners know, our theme for season 7 are the 7 sins of EBP work. And wondered if you could maybe talk about that in the context of this. What would you say is a common sin around this topic?
I think the common sin is like for us as mental health professionals to not be training
Mm.
our upcoming colleagues in what does narcissism look like, what are the types of it, as well as what does narcissistic abuse look like, how to spot it, how to treat it. I think not training ourselves. I think this should be, I know more and more states are including in licensure requirements. They have like spousal abuse requirements. I think this should be
Mm.
mandated as well. Yeah, I think that's kind of it. Like we need to catch up. We need to be training this. And
Yeah.
I think,
Like starting to address the lack of awareness.
yeah, it could be because I think what winds up happening is we are pathologizing the individuals who are
Yeah.
experiencing the abuse as having like, right, like of course they are coming in with whatever it is that they are coming in with when they are experiencing what they are experiencing, right? Like it is a natural reaction to the insanity that they are living with,
Hmm.
right? Like it continues to be a problem that is where the focus, right? Like on one hand, it's like, yes, we should be focusing on on the survivors and not as much on the perpetrators. Yeah, I get that. We actually also do need to be focusing on the perpetrators, because I think for far too long, us as providers have like coddled narcissists, because it is very unpleasant to deal with the narcissistic rage.
Yeah.
And because it is, I don't like it.
Yeah.
I really dislike it, I'll be honest. And I will like also tiptoe around it if I am treating one, but it is like, just, we can't keep doing it. Like, it is not serving us as a society, and it is not serving our patients.
So true. I was, and the other thing I know you said earlier, which resonated with me too, is inadvertently also doing interventions that might place a patient at greater risk because you're
Yeah.
not kind of recognizing
Yeah.
things. So I think that's another sin to add to the list of sins. This is very sinful episode.
So as we always end every one of our episodes, and we've been doing this since the very beginning, we'd like to kind of summarize, like, what are some take-home points? What are some things that listeners can start to do right now? We call it actionable intel.
Incoming actionable intel.
And I've been keeping some notes too. And one that seems to stand out would be educating ourselves on narcissism, how it shows up, and how it, that context of narcissism then also affects somebody's on the receiving end of that. You mentioned a lot of resources that you could provide. So we're going to happily include those in the show notes so that people can check that out. So one piece of actionable intel: check out the resources that Dr. Brody is providing here about educating ourselves, about the importance of us being able to identify this or seeing it in the clients that we're working with. Robin, what else would you say?
I would say check out Dr. Ramani Darvasala. She's phenomenal. She has a narcissistic abuse clinician certification training through PESI, which is phenomenal. She also has a book that I have recommended to patients called It's Not You, that is very accessible. I would also encourage folks to look at the DSM-5 alternate model of personality disorders as a helpful framework for both understanding kind of healthy personality functioning, as well as what it has all personality disorders.
Yeah.
But that has been very useful as well.
Fantastic.
Yeah.
We'll include those all in the show notes too. I already have now added things to my reading list. So
Exactly.
Fantastic.
Well, as usual, you did not let us down, Robin.
Yes.
We definitely appreciate your time. And I think Kevin and I both are going to step away and educate ourselves about narcissism a lot more now.
Yes.
And appreciate, your work in this area and your focus on this clinically with your clients, but also your willingness to chat with us about it. So
yeah,
it's
thank you for your
always a
time, and thanks for
pleasure.
being our friend to come talk to us
Thanks
again.
for being our friend.
Thanks for being my friend.
Checks in the mail. Checks in the mail for the friendship, okay?
Transactional friendship.
It's
Is
a
that
pleasure.
related?
Pleasure. Thank you for having me.
We'll have to have you back on next season, so we just can't break the, we can't
Now
break
it's a tradition.
Yeah, now it's a tradition. The annual Robin episode.
I love this for us.
So for all of you out there, thank you so much for listening. We definitely value you as well. Please do be sure to look at the show notes. Thank you. Check the show notes. And most importantly, be in touch. We love to hear from our
Yes.
listeners on SpeakPipe. You can shoot us an email. Those will both be in the show notes because we want to hear your impressions, your stories. Obviously, we're open to sins as well. So be in touch and don't be strangers. And as always, stay curious.
And mind your EVPs. Bye, everybody.
Bye.
Remember, we love hearing from our listeners, so leave us a message on SpeakPipe or send us an email. Both can be found in our show notes. Our theme music is Failed Attempts by Nitro, and our administrative assistant is Bree Mercer.
Thanks for listening to Practical for Your Practice.
If you like what you're hearing, please feel free to follow us, rate this episode, and share it with others.
Until next time.